When a work-related accident leads to injury or death, it must be reported according to the Reporting of Injuries, Diseases, and Dangerous Occurrences Regulations, or RIDDOR. Established in 1995 and updated in 2013, RIDDOR sets clear guidelines for employers and workers to disclose such incidents. Similar frameworks like FACE and SWA in the United States provide further guidance to prevent workplace injuries. Evidence-based approaches and learning from past incidents are vital for improving safety and reducing risks, especially in large construction projects. RIDDOR Report. When an employee or worker die or injured because of work-related accident, this has to be reported. RIDDOR stands for Reporting of Injuries, Diseases and Dangerous Occurrence Regulations, and was introduced in the year 1995 and was further updated in the year 2013. RIDDOR Report provides rules and guidelines that the employers, self-employed, and any individual working in the office premises are responsible to report the death or injury occurred within the office premise or from any work-related activity. The RIDDOR has provided clear guidelines about what incidents of injuries, accidents and illness are needed by the law to be disclosed to the authorities. In the case of Houston accident, there were totally 7 injuries from which 3 were seriously injured who acquired special attention and were reported serious cases. However, from the remaining 7 workers suffered from minor injuries. Though some of the workers suffered minor injuries, all the injuries and deaths, causalities were immediately reported because of the severity of the case. The reason by which this accident created hype was that the Houston crane accident was not the only accident that occurred in the USA. There had also been reported a series of accidents within a state, such as crane accidents of New York 2007 and Miami 2008. FACE and SWA Report. Similar with RIDDOR Report, under which the deaths and injuries of occupational class are reported, the FACE and SWA reports are also functions similar to the RIDDOR framework. These FACE and SWA reports were developed in the year 1970 by National Institute for Occupational Safety and Health, NIOSH, which is the United States federal agency that conducts research and proposes recommendations for the prevention of work-related injuries. The FACE reports are basically the national research program that is similar to RIDDOR program and is mainly aimed to provide guidance to employees to prevent employees and workers with job-related injuries and deaths by following some guidelines and considerations. According to the research study conducted, these programs and framework investigate selected fatalities and identifying and evaluating hazard. Furthermore, these frameworks also provide guidelines related to development of workplaces. Meanwhile, providing prevention and recommendation to the employees and all associated stakeholders. The effectiveness of the SWA report is well accepted, which is very much similar to the FACE report. Since its introduction, it provides perfect guidelines and precautions to the workers regarding their safety and health management issues, especially in megaprojects. In the case of Houston crane accident, the researcher did not find appropriate pieces of evidence through which he can conclude that guidance of FACE and SWA were also followed by the management of the company. Though the subway construction did follow the RIDDOR construction, the incident could be prevented by adopting the guidelines provided by FACE and SWA. Knowledge-driven health and safety management. The evidence-based approach for safety and health management are essential for addressing and dealing with the technical issues associated with health and safety risk, specifically in the construction of megaprojects. The accidents in megaprojects such as explosion, fire, suddenly fell down of construction mechanism, or any other casualty can be avoided, minimized by acquiring knowledge of health and safety management. In providing the employee and workers with the information related to safety and health management, the role of health and safety professionals becomes more important in identifying the risks associated with health and safety and by providing recommendations and precautions to employee and workers, especially to those workers and professionals who dealt with the operational activities of site. The professionals who ensure the health and safety of megaprojects have to deal with several specific reasons. For instance, The health and safety risks as a result of demolition and structure instability are the most prominent one. The adoption of building information management is the one effective framework proposed by the health professionals in order to provide guidelines and precautions to the construction managers and other stakeholders associated with the construction's activities of projects of all types. In addition to this, these proposed framework and guidelines are suggested to follow in every activity of project in a continuous manner. Furthermore, it has always been important for the managers of megaprojects to develop and follow the systematic approach to ensure health and safety management. In addition to this, the risk management on targeting zero fatality in the construction has demonstrated the importance of knowledge-driven safety management. The examination and evaluation of past experiences and cases of accidents related to construction and management of megaprojects have enabled the professionals to propose and formulate such strategies that will be effective in minimizing the issues concerned with health and safety of the employee working in a construction process. The realization and need for seeking informed decision-making support in project management have enabled the health and safety managers to utilize the knowledge in demanding areas like management of megaprojects to ensure health and safety issues. Learning lessons from past experiences can be effective in minimizing the chances of accidents in the construction and management processes. Similarly, by considering the case of subway construction, in past there have already several cases been reported related to the oxygen cylinder explosion, and that have also caused several injuries and deaths. However, the management of subway construction did not take special attention and was not fully aware of the danger that leads to the casualty. Things can be done after an accident that can minimize the effects of the certain accident. The understanding and examining of accidents can only be possible by determining every single cause of accident. The evidence-based learning methods have been the most effective approach that the professionals and clinicians have adopted. It has been rated as the instrumental approach to support effective professional learning and in problem solving. In light of the study conducted on, the evidence-based practice has been introduced in clinical practices for carefully examining and implementing best practices in decision-making. Furthermore, the general practice of evidence-based learning involves the assessment of patients specifically asking particular questions from patients regarding the incident or any casualty. In addition to this, the evidence-based learning also involves appraising the evidence and incorporating the evidence with clinical expertise, meanwhile evaluating the performance. However, the evidence-based learning to health and safety management in megaprojects involves the consideration of facts, experiences, expectations, the project guidelines and regulations, meanwhile considering the project design through a similar procedure. According to the research study conducted by the evidence-based learning has greatly integrated the evidence-based management. In addition to this, the evidence-based learning in light of management has both the levels that are strategic and tactic level. I have added the citation for reference for academic professionals in the description box. Please like, follow, and subscribe for more updates.